Thank you. My name is Aaron Hemmel from PATH. Dr. Lusingu, you referred to research and development in Africa as contributing to capacity building. I'm wondering what you meant specifically by that, if you can provide some examples. And I'm also interested specifically in how that capacity building may contribute, if it does, to sustainability of aid and development. Thank you very much.
Thank you for a good question. When I talked about capacity development, I meant strengthening of the capacity that is there in Africa in terms of human resource. When we talk of human resource, we have seen a lot of individuals being trained at a PhD level, master's level, and also in the understanding of the good clinical and laboratory practice, so that they can conduct studies that are recognized and that can be approved by regulatory authorities like Food and Drug Authority here in the USA, and also the WHO can recognize and really comment on that. So let me give you a good example from where I come from. Back in the year 2000, when I started working in the medical research, we were having only three laptops computer in our institute, in the center which I was working, and we had to make a queue so that one can get in and at least write something, a proposal, so that can submit for funding. It was really chaotic. But with the multilateral initiative on malaria, there has been more funding, and we had the opportunity of getting more computers. So the IT technology increased. And later on, when we got engaged in the basic research, we worked in the hospital, whereby we had a very rudimentary laboratory, because it was a hospital kitchen of the district hospital, which was converted into a laboratory by funding from Danida, Denmark. And then later on, we got funding from Malaria Vaccination Initiative, Gates Foundation. We managed to build a modern laboratory. That's what I said. I have leaflets which are outside there. We have a new microbiology equipment, the main one and the backup, and also we managed to have hematology equipment and the biochemistry equipment. So that is in terms of infrastructure. In the community within the district that I'm working also, we managed to build vaccination centers, whereby we can really do vaccination at very close to the community. So we built almost 8 vaccination centers, including the district hospital now that has developed very much in terms of the pediatric care, the quality of care, the availability of diagnostic services, and also the availability of human resource in terms of medical doctors who are really available to treat and take care of the patients who are available. But also within the technology development, the communication development, the availability of mobile phones everywhere now. Even the community, they can even communicate with us when someone is sick, especially the study participant, and we can communicate with them back and forth. And also the transport system has improved. We have ambulance system from the money that was donated from RMBI to make sure that we can conduct this phase 3 study. So there has been a tremendous capacity development in terms of human resource and also availability of infrastructure. But the issue now which we have to question ourselves is about sustainability, because we are donor dependent to almost 99%. And once donors, they say, no, we cannot no longer support you, the issue is going to go back to the government. And as you know, the governments in Africa, majority of them, they are very poor, especially in our country. But also there might be other source of mobilization of resources that might be sustainable. And that's why we come to a meeting like this one, discuss with you that it's very important within the global health to support each other. It's a moral obligation that, you know, as we have this globalization, people from America would like to go to Africa and see whatever is happening in Africa, what was there, for historical purposes, and also for kind of the issue of peace and here and there. So the capacity development that is there in Africa, the infrastructure that has now improved in Africa to conduct clinical trials. For instance, where I come from, we are conducting malaria vaccine trial. But when malaria vaccine comes to the end of phase 3, we can even conduct HIV/AIDS vaccine trial. We can conduct other vaccine trials that are available because of the availability of the human resource that has already built capacity that can conduct high-level kind of clinical trials. Thank you.